Hello everyone and a very warm welcome to you. My name is Amna and it is such a joy to have you here with me today. In our last video, we explored the fascinating world of how drugs interact with our bodies on a microscopic level. We talked about receptors being like locks and drugs being like keys and how that elegant relationship determines a drug's effect. We also touched on the critical idea that the dose we give is carefully chosen to maximize benefit while minimizing harm. And that very idea is the question we are going to dive into today. Have you ever wondered how doctors figure out the perfect dose of a medicine? Not too much, not too little, but that just right amount to help you feel better without causing problems? It might seem like a mystery, but it's actually a beautiful science. Today, we are going to pull back the curtain on this process. We'll explore the two fundamental principles that guide every single dosing decision. These principles are called pharmacokinetics and pharmacodynamics. And I promise you, by the end of our time together, these big words will feel as simple and familiar as old friends. So let's begin our journey. At the very heart of this science is a simple but powerful idea. The link between the dose of a drug you take and the effect it has on your body is the concentration of that drug in your system. Getting that concentration right is everything, and this is where our two main characters come into play. First, we have pharmacokinetics. This is simply the story of what your body does to a drug. Think of it as the drug's journey through you. This journey has four main parts. First is absorption, which is how the drug gets into your bloodstream. Second is distribution, how it travels out of the blood and into different parts of your body. Third is metabolism, where your body, mostly the liver, chemically changes the drug. And finally, elimination, which is how your body gets rid of the drug for good. Our second main character is pharmacodynamics. This is the other side of the story. What the drug does to your body. Once the drug reaches its destination, how does it create an effect? This is where we talk about concepts like the maximum possible effect a drug can have and how sensitive our body is to different concentrations of it. So pharmacokinetics is the body acting on the drug and pharmacodynamics is the drug acting on the body. It's a beautiful two-way relationship. Now, to really understand this, we need to get to know two of the most important players in pharmacokinetics, the volume of distribution and clearance. Let's start with the volume of distribution. Now this sounds a little strange because it's not a real physical volume that you could measure with a cup. It's an apparent volume. It's a concept that helps us understand where a drug likes to go after it's in our body. Imagine you have two pools of water. One is a tiny little wading pool and the other is an enormous Olympic-sized swimming pool. If you add one drop of red dye to the tiny wading pool, the water will become very red, right? The concentration is high. But if you add that same single drop of dye to the giant Olympic pool, you might barely see a change. The concentration is incredibly low because the dye has spread out into a huge volume. A drug with a small volume of distribution is like the dye in that tiny wading pool. It tends to stay right in the bloodstream. A drug with a large volume of distribution is like the dye in the Olympic pool. It spreads out far and wide into the body's tissues, leaving very little behind in the blood. This concept is so important for figuring out how much drug we need to give to get the right concentration in the blood. Next up is clearance. Think of clearance as your body's highly efficient cleanup crew. It's a measure of how quickly your body is able to remove a drug. But here's the key. It's defined as the volume of blood that is completely cleared of the drug per unit of time. It's not about how much drug is removed, but how much blood gets scrubbed clean. This is the single most important factor for determining what the drug's concentration will be once it reaches a stable level in the body. For most drugs, this cleanup process works in a very predictable way called first-order elimination. This just means that the more drug there is, the faster the cleanup crew works. A constant fraction or percentage of the drug is removed over time. However, for a few drugs, the cleanup crew can get overwhelmed. The system gets saturated. When this happens, they can only work at one constant speed, no matter how much drug is present. This is called capacity limited or zero order elimination. It's a bit more dangerous because if the system is saturated, even a small increase in the dose can cause a huge, disproportionate jump in the drug concentration. All of this leads us to a term you've probably heard before: half-life. The half-life of a drug is simply the time it takes for the amount of drug in your body to decrease by 50%. It's determined by both the volume of distribution and the clearance. The half-life is incredibly useful. It tells us how long it will take for a drug to reach a stable, steady level in the body, which is usually after about 4 to 5 half-lives. And it also tells us how long it will take for the body to eliminate most of the drug after you stop taking it. Again, about 4 to 5 half-lives. Isn't that elegant? Now let's talk about how the drug gets into the body in the first place. When a drug is given intravenously or IV, 100% of it goes directly into the bloodstream. But when you take a pill, it's a different story. The fraction of the drug that successfully makes it into your systemic circulation after you take it is called its bioavailability. For a pill taken by mouth, this is often less than 100%, and there are two main reasons for this. First, the drug might not be fully absorbed from your gut, but the second and often bigger reason is something called the first pass effect. After a drug is absorbed from your intestines, the blood from your gut doesn't go straight to the rest of your body. It first takes a trip through the portal vein directly to the liver. Think of the liver as a processing plant or a toll booth. It sees the drug coming and immediately starts to metabolize or break it down. For some drugs, the liver is so efficient at this that a large portion of the drug is eliminated before it ever gets a chance to reach the rest of the body. This is the first pass effect, and it's why some drugs have very low oral bioavailability. Interestingly, we can use other routes, like placing a tablet under the tongue or using a skin patch to bypass this liver toll booth and get more of the drug directly into the bloodstream. It's also fascinating to see how a drug's effect can change over time, and it doesn't always perfectly match the concentration in the blood. Sometimes a drug's effect can last much longer than its half-life would suggest. This can happen when the concentration of the drug is so high that it's completely maxing out its effect. Even as the drug level starts to fall, as long as it's still way above the amount needed for a strong effect, that effect can remain stable. In other cases, there can be a delay between the drug concentration in the blood and the clinical effect we see. A wonderful example is the blood thinner warfarin. The drug works very quickly to stop the production of new clotting factors in the body. But the clinical effect we measure, the change in blood clotting, doesn't show up until the existing clotting factors, which have a much longer half-life, are naturally used up. And for some drugs, especially in areas like cancer treatment, the most important thing isn't the peak concentration, but the cumulative or total exposure over time. So how do we take all of this wonderful science and use it to create a practical, rational dosing plan for a patient? It all comes down to something called the target concentration strategy. The goal is to pick a target concentration of the drug in the body that we know is effective and safe. This is called the therapeutic window. Then we use our pharmacokinetic principles to calculate a dose that will achieve and maintain that target. To maintain that level, we calculate a maintenance dose. The principle here is simple and beautiful. To keep the drug level steady, the rate at which you give the drug must equal the rate at which the body is eliminating it. Rate in must equal rate out. But what if a drug has a very long half-life? It could take days or even weeks to reach that steady therapeutic level. If we need the drug to work quickly, we can't wait that long. This is where a loading dose comes in. A loading dose is a single larger initial dose designed to quickly fill up the body's volume of distribution to get us to our target concentration right away. Of course, we are all unique individuals, and one size fits all rarely works in medicine. Many patient-specific factors can change how a drug behaves. Things like kidney or liver disease can dramatically reduce the body's ability to clear a drug. Age and body composition can change the volume of distribution, and even the amount of proteins in our blood can matter. Many drugs travel through the blood by binding to these proteins, like passengers in a taxi. Only the free drug that gets out of the taxi can have an effect. Changes in these proteins can affect the total amount of drug we measure in the blood. This is why, for some medications, we directly measure the concentration in a patient's blood to ensure we are in that safe and effective therapeutic window, making adjustments as needed to truly personalize their care. So let's take a moment to reflect on what we've learned. We've seen that pharmacokinetics is what our body does to a drug, and pharmacodynamics is what the drug does to our body. We discovered how core concepts like clearance, volume of distribution, and half-life are the scientific building blocks that doctors use to design the perfect dose for you, a dose designed to give you the most benefit with the least risk. It's a process that is both deeply scientific and deeply personal. And now I would absolutely love to hear from you. Was there a concept today that really clicked for you? Do you have any questions at all? Please don't be shy, let's chat about it in the comments below. I truly enjoy reading your thoughts and insights. Until next time, stay curious and take wonderful care. Bye for now.